So I want to let everyone know that now. And so I am Tometta Cozart. I serve as the Multicultural Outreach Program Director for the Epilepsy Foundation, and I'm really excited for everyone who has joined us today. We're going to go ahead and get started because we have a very full session. So I want to let everyone know, if you're not aware, that we have had 3 cohorts of mini grants. And so this particular cohort, we had 9 projects that received $10,000. And they started in about March in terms of their activities. Some of their pre-planning had to do with being able to make partnerships with multi-sector organizations, and then also being able to focus on the social determinants that we were highlighting this particular year, which was housing and food. Concluding at the end of September. So all of the grantees had to have some level of a multi-sector partnership. The partners that we highlighted nationally were the National Association of State Offices of Minority Health, the American Public Health Association, and then also the National Area Health Education Centers Organization. So members from their national organizations presented each month as a part of our monitoring meetings, and that really helped with being able to create opportunities for our grantees to be able to connect with their state level representatives. And so with that, you'll hear with some of the projects that they were able to join some of their local health coalitions. Some were able to be connected with their state offices of minority health, and then others were able to partner with some of their area health education centers, in addition to other partnerships. All of them were intended to be able to address epilepsy disparities amongst diverse populations. They also really need to be able to find a way to identify the social needs of the people living with epilepsy in their state or region, and then how were they going to make linkages and So I just wanted to provide a preview of, as we're planning around the social determinants that we're going to focus on in the next 5 years, just for planning purposes for those out there who may be interested in applying for future grants. As I said before, this year we focused on housing and food insecurity. Next year, we are going to be looking at rural health and all of the issues that come with living in rural areas, including transportation, being able to have access to culturally and linguistically appropriate services, being able to have access to specialized care, navigating the healthcare system, social isolation, and then we also will be looking at having access to digital resources as well. And then being able to work with lay health workers, promotores, and community health workers to be able to address those disparities are what we'll be looking at next year. And we'll talk a little bit more about that in a minute. We will also be looking at education the year after that. Our anti-stigma campaign will be up and running, and so we'll be looking at how we can integrate those resources into local efforts in year 4. And then in year 5, we'll be looking at poverty, income, and other issues around employment. So again, to give a more of a preview of next year, so again, for people who are preparing, please do consider your partnerships now. We're looking for you to have partnerships with one or similar organizations that we are partnering at the national level. So the National Association of Rural Health Centers will be one of our partners. National AHEC organization will continue on to partner with us. UMA Health and Community Health Worker Coalitions will be working with us. And then the National Digital Inclusion Alliance. If you've never heard of some of these organizations and you would like to see if there's a local entity that you can work with, please do let me know so that we can start working on those partnerships. A letter of intent to apply will be due by the end of this year, and then those who are invited to provide full applications, that will not be due until next year. Some of the considerations from what we've learned for the projects so far is that, again, you want to start your partnerships early. You do want to consider the aspect of reaching out to our information and referral line if you're need to learn more about the social needs of the people living with epilepsy in your state. They can help you in terms of learning who has called for which resources, and then also they can help you with referrals as well. And then public health interns are a great asset to be able to help with the support of monitoring and managing a mini grant project. Okay, so with that, we will hear from Kentuckiana, Delaware, Angels of Epilepsy, Central South Texas, Connecticut, When the Trumpet Sound, Los Angeles, National African American Wellness Agency, and then Minnesota in that order. All right, so Beth, are you ready?
I am. Okay, so hello, everybody. My name is Beth Stivers. I'm the Director of Education for the Epilepsy Foundation of Kentuckiana. And our project name was #Epilepsy Equity and #Food and Housing Security for African Americans on Team Kentucky. So Kentucky has a 16% rate of African Americans living in our state. We do know that those individuals have a higher risk of getting epilepsy, as well as a higher risk of having food and housing insecurities. So our project really focused on reaching out to, we worked with AHEC organizations, 2 of them in Kentucky. We worked with the Southern Kentucky AHEC, which reached out to different southern areas of the state, as well as the Northwest Kentucky AHEC, which serves a lot of the clinics and whatnot in West Louisville, which is an area that is highly populated with African American individuals. So the project objectives that we had, we reutilized a lot of the stuff that we did last year and just updated it for to include food and housing security information on them. So we reshared the PSA, we updated that, and then did a Facebook campaign where we had almost 125,000 impressions of that and reached over 42,000. We redid our bus ads, and you can see the ad there on the top right of the screen. We had them on, some of the buses had them on the side, some of them had them on the back, and then we also in Louisville and Lexington. In Louisville, it was the outside of the buses, and in Lexington, we did some inside of the buses as well. And so with that campaign, we reached, and that was a 4-week campaign. The prices unfortunately had gone up since the last time we did this, so we weren't able to do the full 8 weeks with the money we had, but we reached over 1 million, had over 1 million impressions with that. So we were very pleased with that outcome. We provided 14 virtual seizure first aid certification training programs. Of those programs, we provided programs for AHEC scholars, which are college students that are going into health professions. And then we also did 2 programs for the summer camp programs, one for Southern Kentucky and one for the Northwest region. The other cool thing about this, though, is with that partnership, we are also going to be able to reach out to HOSA, the Health Occupation Students of America. Our contact at one of the AHECs is going to put out an e-blast to all of those schools that have those in Kentucky. So hopefully we will be providing these seizure first aid certification programs for them. So we do see a lot of sustainability with this partnership in terms of our programs continuing on after the grant ends. One of the things that we was a major goal of ours, which unfortunately in lessons learned, getting a panel together to provide a CME program has been a little bit of a challenge, but we have it scheduled right now for September 16th, but it's looking like we're going to have to bump that a little bit out. But we will be providing CME or CE credits for physicians, as well as a multitude of different healthcare professionals. So that program will be an hour-long program live. And then we will also be putting it, Southern Kentucky AHEC has a portal where different CE opportunities are available on demand. And so we will be able to put that up to have it on well past the granting period and beyond. Also, we have over 9,000 impressions of the epilepsy equity hashtag, and I can't see the bottom of my screen, but you can see the number of total impressions that we've had It is over 1,137,000 total impressions. So we are pretty pleased with our outcomes of the different projects that we have done for this grant. Here you can see on the right there, the buses with the ads on it. So we're pretty excited. I'm sure we got a lot of individuals that got our contact information. And then also here is the PSA that we updated. We are also going to be having that on the website, and we've compiled a list of various resources for individuals to have food and housing security resources. The other thing that we've done through this grant is we have updated the way we are capturing our demographic information, and through the registration process for our programs, we are including many questions about different race and basically the questions that are asked on the helpline. So we are gathering that information, and then we are reaching out to those that identify as having food and housing security issues, so that we can meet them head on with their needs. So that is it. I'll show you the PSA real quick, and then I'll move on.
Any one of us can have a seizure. 1 in 26 will be diagnosed with epilepsy in their lifetime. African Americans are more likely to develop epilepsy than white Americans. More than 20,000 new cases of epilepsy are diagnosed among African Americans each year. Learn the 3 simple steps of seizure first aid. Stay with someone when a seizure occurs. Keep them safe. Place them on their side without restraint.
And just so you know, the beginning picture, we're pretty proud. That is our social worker's son. Unfortunately, he does have epilepsy, but we were glad to get to include him on this year's PSA. So, any questions? Or are we going to do questions at the end?
Yes, we're going to do questions at the end. And I also, before we move on to that, thank you so much, Beth, want to highlight Kentucky Anna for reusing national campaign resources. So the ads that you saw was part of the Essence campaign that we did in 2019. So, all right, Val, are you ready?
Can you hear me?
Yes.
Okay, great. So hello, everyone. My name is Val. I'm the Executive Director of the Epilepsy Foundation of Delaware. And we are a small but mighty team of 1 full-time staff people and 2 part-time at this point. So we do a lot with the little, and we don't have a cute photo of a kid, but I really enjoyed your presentation, Beth, and doing awesome things. So thank you. So our project today, what we decided to focus on was twofold. So we are a part of an organization called Family Shade here in Delaware, and this multi-sector organization is designed to work with children with special health care needs through agencies and organizations that do that, and also the parents of those children as well. So we partnered with them and tried to kind of create connections, offer seizure first aid, and really kind of focus on food and housing insecurity. So we also decided that we should become a member of the Delaware Public Health Association, which is called Delaware Academy of Medicine here in Delaware. So that was kind of our goals of our project. Next slide, please. So how did we accomplish this? So what we did was we became a member of the Delaware Academy of Medicine for 6 years, and this enables us to attend their workshop sessions, get information from them, but also to share information back and offer seizure first aid certification and that kind of thing. And to be able to have that public health information that's so vital for folks here in Delaware. So one of the other outcomes that we are still working on is having a meeting with the Food Bank of Delaware, with WIC and Habitat for Humanity. So when we were looking at Family Shade and the organizations that were part of this multi-sector umbrella organization, these organizations were left out. And I was speaking with folks at Family Shade, and we were both, realizing that this was something that was lacking. And, housing and food insecurity really is an issue that is important for folks with epilepsy, but also, across all of these agencies and for those with disabilities. So we decided it was mutually beneficial to meet with these folks explain what we do, both as the Epilepsy Foundation of Delaware and as Family Shade, and to exchange information, create that communication, that linkage going forward. So the folks at Family Shade have a contact with those organizations and are working on getting a meeting for the three of us together. I'm hoping to have that completed by the end of this month. So the next thing that we did was we offered the seizure first aid certification for folks here in Delaware on 8/15 and 8/16. And so that was just 2 days ago and yesterday. And that number has changed since I completed this presentation. We actually registered 66 folks in those 2 sessions. And it was interesting because we had folks join us from Delaware Autism, from the Parent Information Center, which is the organization that houses Family Shade that works with children and students on IEPs, 504s, and equal rights for students with disabilities in schools. We also had teachers, we had government workers, state workers. So it really had a broad reach. I was really exciting, a lot of participation, really good classes. So we, as the Epilepsy Foundation of Delaware, publicized these events through our channels, and Family Shade did as well through emails. And you can see their e-blast over here on the left that I put in here. So they also had us on their social media as well. So really trying to kind of create those networks, those communication, and to kind of keep it going. What I really enjoyed about this project was the resources, the communication, and kind of like the future thinking and forward thinking that came out of it. So the additional outcomes. So as I was meeting with folks from Family Shade, we were talking about housing for folks with disabilities here in Delaware. And I wasn't aware, but now I know that the Developmental Disability Council, DDC, is creating a housing guide for people with disabilities here in Delaware. So I'm really excited when that comes out. That'll be a great resource for our folks. And the other thing that we realized was that both Family Shade and the Epilepsy Foundation of Delaware were doing conferences. So we shared that information. We invited each other to our conferences to, have tabling events and to, further kind of share that information. And the last outcome that I thought was really exciting was that Family Shade introduced us to the Delaware Library's listserv. So this is a place where nonprofits and organizations can send information to Delaware libraries, and then they send out to everybody on their listserv about events, programs that are coming down the pike. So really kind of exciting for the future of communication and creating a community where people can find what they need and the resources are there. So still working on our meetings with the food bank and Habitat, increasing those linkages for food insecurity and housing, but really excited for the future, even after the end of this grant cycle. So thank you.
Thank you so much, Val. Now we'll hear from Natalie with Angels of Epilepsy. Natalie, are you ready?
Yes, I'm ready.
Okay.
Hello, everyone. I am Natalie Beavers. I am the founder and president of Angels of Epilepsy outside of Atlanta, Georgia. We first of all would like to give a special thanks to both the Epilepsy Foundation and the CDC for just allowing us to participate with this particular grant. It was definitely, we dealt with many in the epilepsy community, but we also assisted many who may be in need of food and housing, as well as work and employment. So this was kind of new to us, but we definitely learned a lot from this. Being an epilepsy organization, again, it was somewhat new for us, related to food and housing insecurities. But we also give much thanks to our sponsors, Lust Ministries organization, who is in the Cobb County area of Georgia, who deals with food and housing. They even have actual housing for those who are in need of shelter, as well as other locations that provide food, as well as other needs for those who are in need of help. We definitely had a lot of events that took place. On May 14th, Lust Ministries had a health fair located at Marietta High School, As you know, Angels of Epilepsy, we gave much epilepsy and information and resources. We noticed that there were many Hispanics at this particular health fair, and we gave a lot of information. One of our interns, who's actually on this particular meeting as well, Stefan, he knows a lot of Spanish, so he related to them as well at this event. We only had 14 people to complete our questionnaire that was related to the SDOH data analysis at this particular event. The next event was on the same day. It was virtual with the Morehouse School of Medicine Epilepsy Community Resource Series. 42 people registered for this particular event. There were only 21 attendees on that particular day. There were survivors who spoke their experience dealing with epilepsy and seizures, as well as mental health. There were physicians, groups, and organizations who also were present to speak about mental health and management and services that are available to them. At this particular event, Angels of Epilepsy gave away the seizure diary and the medical ID accessories during the raffle gift giveaways. On June 18th, our partner, Must Ministries, had another health fair. It was at the Walton Ridge Community Center in Cobb County. Again, we gave away much epilepsy information and resources. We did give away gift cards at this particular event because we wanted more people to participate in our questionnaire, our SDOH questionnaire. We did have 22 people to participate for this questionnaire. And this event was absolutely great. On June 25th, Angels of Epilepsy, again with our partner, Morehouse School of Medicine, we did the seizure first aid certification with Dr. Raquel Quarles and Dr. Fariba Furivach. There were 90 people who registered for the seizure first aid training, but unfortunately there were 45 who were in attendance to become seizure first aid certified. The training session, it went well. There were many people who asked questions. And we also had Angels of Epilepsy interns to also become seizure first aid certified. On July the 23rd, Morehouse School of Medicine, and they had another epilepsy community resource series. It was entitled Teachers and Epilepsy. And there were 49 people who registered and 34 in attendance for that virtual event. We had teen epilepsy survivors and parents to share their stories. Epilepsy advocates in Georgia also spoke on how they're trying their best to push for the seizure safety school law in our state of Georgia. Much epilepsy information and resources were also spoken and expressed at this event. And Angels of Epilepsy also gave the seizure first aid diaries and medical ID accessories during the raffle gift giveaways for that particular event. The next event on July the 30th, this was not on the agenda, but we wanted to get more of the data analysis related to the social determinants of health related to the grant. And someone that we know in Atlanta who has a barber shop was doing a back to school event. And we called and asked them if we can participate, have a tent outside their barber shop to give away epilepsy information and resources, and to also ask them to participate in the questionnaire related to the health disparities and social determinants of health. So unfortunately, that event lasted only 2 hours due to heavy rain. So we did receive 8 participants to participate with the questionnaire and for our data analysis. Our last event, which was over a week and a half ago, it was on August the 6th. Again, with our partner, Must Ministries. It was the Must Ministries Mobile Pantry Back to School Drive and Health Fair. This event was honestly remarkable. It was a larger crowd, larger number of participants of the SDOH questionnaire. We had a total of 76 people to participate in the data analysis questionnaire. So we were greatly appreciated for that. We also met many who are living with epilepsy and seizures as well that approached our table and say, hey, I have epilepsy, or I know someone who has epilepsy. So that was also great as well. We gave away a lot of epilepsy information and resources. So again, Angels of Epilepsy had a summer full of events collaborating with multiple partners in the Metro Atlanta. And here's a summary of our data we've collected with our SDOH questionnaire. Amongst our 120 table participants, 81.7% female, 18.3% male. 72.3% were Black African American, 15.8% were Hispanic Latino. 7.9% were white or Caucasian, 3% were Asian, and 1% other. 7.5% are either epilepsy survivors, parent or caregiver. 42.5% of those table visitors knew someone living with epilepsy or seizures. 28.3% are in need of monthly food assistance, with the main focus in finding financial assistance. 31.7% are in need of finding or keeping housing, with main need of financial assistance. 28.3% are in need of medical and health care assistance, with finding health insurance in the main focus. It was so amazing. Again, this was somewhat new to Angels of Epilepsy because our organization is based on epilepsy and seizures, but partnering with the Must Ministries organization, as well as Morehouse School of Medicine, we learned a lot in reference to a lot of this and just helping those within the community. So the social determinants of health, again, food and housing, those particular areas within our organization, we are definitely deciding to keep. We've also asked Must Ministries if we could continue to partner with them and do projects with them for the near future. So thank you all so much.
Thank you. We're going to move on to Kimberly.
Hi. Am I controlling or you're controlling?
I am controlling.
Okay, perfect. Okay, so I had a lot of information to squish into the two slides, so I apologize if everything looks overlapping. So our first goal was to create, to kind of implement a formal social determinants of health screening tool within our affiliate. Now, we had a non-formal one that we've been doing for quite some time, but we wanted to, after seeing the tools and kind of going through our conference that we had, our PHI conference, we were able to take that information and kind of create our own one that was customized for our affiliate. And so you can see there, and it's very hard to see those, so I'm going to kind of tell you what some of those are. But the screening tool, there's a paper version of it that you see kind of on the left. I kind of overlapped it with the results of what we have seen so far. And we actually took that screening tool and added it as a custom object in our Salesforce. And so we're able to now electronically track those. And so we had public health interns that were helping us create kind of to get the stuff in there, and they're kind of now working on entering the data from the paper ones that we did. So today we've trained 32. Our goal is 50. We're still working on these now we were trying to get 50 by the end of the month, but we just, didn't have, believe it or not, summer was pretty good for us. We weren't getting as much of calls for people that had those needs that we needed to do screenings for. So our tool here, as you can see, what we got the most requests for was actually mental health. We had, out of our 32, 20 people were requesting mental health assistance. We had 14 people that had food insecurities, 16 utility assistants, and then both employment assistance and access to healthcare, where we had 12 people that were requesting that. This during the time period that we did this, our housing was about 5 people, only 5 people that contacted us about housing, which was kind of interesting because a few months before that, we were getting a really high volume number of calls for housing assistance, and that kind of dropped a little bit. So I'm not sure if here locally in our area, if some of those housing issues were able to get resolved. I know we did a lot of work with our San Antonio Housing Authority to try to help find people some stable housing. So that's kind of with the screening tool. We also did, one of our other goals is to provide a hybrid workshop for 100 patients and caregivers focused on promoting promotion of self-management, healthy lifestyle, and just resources for them so that they can increase knowledge about what's in the community and knowledge about epilepsy and self-management. So this is scheduled because of the facility that we're doing it at is still actually being built. The grand opening is not even of that facility is not even until October the 2nd. But they were able to get the conference center is done, and so we'll be able to, other than being able to do the hybrid because they're not going to have their equipment ready in the space by August the 27th. But 26th is move-in date for the people that are going to be working out of there. We have a cubicle in this building as well, which is kind of great because it will put us in with a bunch of other community organizations that are providing these types of opportunities for people, not just with epilepsy, but other people with disabilities. And so we'll be working with people that also have autism and epilepsy and other conditions that have epilepsy as a comorbidity. So this conference that we're doing is scheduled for the 27th. It's a 9 a.m. to 2 p.m. conference. Our topics are epilepsy and disability. We have an attorney that is going to talk about that. We have reducing stress and anxiety. One of our PhD people that was part of our behavioral health panel is actually doing that session for us. We'll be talking about self-management. And then we have the community resource panel where we have Opportunity Home San Antonio. That's the rebrand of the San Antonio Housing Authority. They will be there talking via Metropolitan Transit, Family Services, which does a kind of a variety of community things, and then San Antonio Food Bank will all be on our community panel, kind of talking about what their resources are, what they have available to the community. And then, of course, we're going to round up that conference with a seizure first aid training for people that are attending. To date, we have 36 people registered, so it's a little bit low, but we are doing a marketing push. And just from running previous conferences, we typically get the highest number of registrants the week of the conference, and so we're hoping that we get closer to that 100 patient caregiver goal that we're pushing for. You can go ahead and go to the next slide. So the third thing that we did was we providing epilepsy resources, and our goal we set was 250 people through our collaborative partnerships, and so we are actually pretty fortunate to be able to make some new partnerships with this grant. Of course, we did Texas Public Health Association, and you can see there we had a virtual booth at the Texas Public Health Conference that was held in May. So you can see I kind of put a couple pictures there from our virtual booth. I did reach out to them to try to get statistics from how many people visited our booth, how many links were clicked and stuff, but I have not been able to receive that information back from them. And what we did struggle a little bit in the beginning of trying to get partnered with them, and I don't know if others that worked with the State Public Health Association struggled with that a little bit, but we did a little in our area. So what we ended up doing was we also reached out to some other offices that we thought might help. And so one of the biggest partnerships that we made that was good for us was working with the Texas Office for Disability Prevention in Children. And then they introduced us to the Texas Office of Acquired Brain Injury, so these two state agencies. And of course, the MAC Multi-Assistance Center at Morgan's Wonderland, which is scheduled to open for the grand opening in October. We are working with them for our conference. And so so we were a vendor there. We did a webinar in collaboration with the Office of Acquired Brain Injury and with the ODPC. 324 people attended this first webinar that we did. You can see there's one of the quotes that we put, or two quotes actually, that we put from people that attended that. And that was just kind of an introduction. So what that did, and one of them said, have never been to a webinar that included epilepsy. I learned a lot. And so that kind of prompted the folks at both ODPC and OABI to kind of look at maybe we need to do something more that's only epilepsy specific. So we kind of went from there and we talked about doing a statewide seizure first aid recognition training. And out of that training, we had, I believe it was actually 1,092. That's kind of a typo. We had 1,092 people registered. We had 619 that actually attended and 352 that became seizure first aid certified. So we had a pretty good numbers from that statewide training. It actually reached out to multiple agencies across the state. So we had lots of trainings that actually requests that came up afterwards to be able to train in their respective agencies, people that actually attended the seizure first aid training. We did direct some people to do the on-demand training as well. And again, from our initial webinar that we had, we trained 55 vocational rehab counselors from across the state that were specializing in traumatic brain injury. And same thing we've got two trainings coming up, one at the end of August and one in September, for 2 additional Texas Workforce Commission trainings for VR counselors. And so these are some new partnerships that we made, and we would not probably have gotten into had we not met with the Office for Disability Prevention in Children. So I think that kind of was a big hurrah for us to get into work with them. You can see down there, I put some stats, 690, we had a 61% attendance rate, which is pretty good for a webinar, and then 57% for the very first one that we did. And so that's got it. That's all that I have.
Thank you so much. Is Monica or Sherry on?
Hi, yep, this is Monica. Hi from Connecticut. I am the Director of Programs and Services at the Foundation in Connecticut. And we were actually partnered with the Health Education Center located in Norwich, Connecticut for our project. They actually reached out to us expressing an interest in participating in this grant. And the Health Education Center just happens to be located in the part of our state that we feel is very underreached as far as sharing epilepsy information with them, reaching those that have epilepsy in that part of the state. And so it just kind of came together very well. And therefore our title, you can see, was addressing social determinants of health in people with epilepsy in Eastern Connecticut. And I'll just share here our objectives, which you can see, but I'll read them, which was to establish if there's an unmet need of food and housing for people with epilepsy by distributing a survey to at least 50 people with epilepsy. And, we know obviously with certain calls that we receive from clients that there are some that have expressed a need in these areas, but overall, we really don't have that information in our state. So we were hoping that this would be a start to learn more. Second, the second objective was to provide seizure first aid and recognition training to 30 students entering the medical field. And then lastly, to educate about 100 direct care service providers about epilepsy and the services that we provide. You can see to the right of the screen our partnerships, and I will highlight the Hartford Healthcare Eye Neuroscience Institute. They actually have an office that is located in Norwich, Connecticut, in the eastern part of the state. And that office, as well as their office, which is located in Hartford, Connecticut, allowed us to distribute surveys at those 2 locations. And so that was great because we knew that we would be reaching patients directly that have epilepsy by administering the surveys at those 2 locations. And then also the other really important partner that I want to highlight here is the Eastern Connecticut Health Collaboration or Collaborative, and that is a part of United Way of Southeastern Connecticut. There are actually collaboratives all across the state that I just learned about. So this was a very new partnership and resource for us here in Connecticut. And again, something that I was not aware of. And basically what they do is they have what they call health hubs in that part of the state, Eastern Connecticut, and they go around to different sites. They actually partner with Hartford Healthcare in doing this to provide healthcare screenings. And then they also have different service providers in the community attending these health hubs to share information with patients that come and are getting surveyed. And, we actually even were able to engage with those that were in need of housing at these particular events, which I'll talk a little bit more about here in a second. And then you can see here the Thames Valley Collaborative Association. They are also in that part of the state, and we were able to do a virtual training for the entire staff there. And they provide anything from housing to helping people apply for food stamps, and then basic case management they provide. So they do kind of everything. They're a big community action agency. And then you can also see the New London Homeless Hospitality Center, who we also were able to provide a training to. Lastly, the Community Health Workers Association, who I've been working with now for several years, where they actually provide training to those community health workers or those that are in training to become community health workers. And so we were able to partner with them too. Okay, I'll go to the next slide. And what we did in order to determine whether, what the level of need was in the epilepsy population as far as food and housing is concerned was we did create a survey. And in that survey, what we did was we just took the Epilepsy Foundation of America demographic sheet. And then we also took questions specific to food and housing that came from the American Academy of Family Physicians. And then lastly, what we did is we added a few other questions on these surveys that included, do you need help in accessing these resources in your community? Would you like to know more about the Epilepsy Foundation? Would you like to know more about the Health Education Center? And so these surveys, again, were distributed at the Hartford Healthcare sites, the 2 Hartford Healthcare sites that I mentioned. And then they were also inserted in a SurveyMonkey that each participant of the trainings that we provided also took this survey. So we were able to get a whole came from a very large, diverse population. And you can see here just some of the outcomes of the survey. We had a total of 98 surveys that were completed, 19 of which were by people with epilepsy. And these final results showed that 26% of people with epilepsy found that they were in need, or stated that they were in need of food assistance, and that we compared nationally, which nationally the statistic is 10.5%. And then also we had a total of 44 resource workers that took a survey. I feel like there's so many different pockets of people that we reached through this grant, which was great. But amongst those resource workers that completed this survey, they stated that 20% of their clients worried about food insecurity that experienced or that had epilepsy. With housing, 16% of people with epilepsy mentioned that they were in need or were housing insecure. And that was compared with 10 to 15% nationally. And then lastly, 25% of the resource workers stated that their clients were in need of help with housing. Okay, so as far as the trainings go, so we did provide training, not as many as we had hoped for and as stated in our objectives, but for the students, we provided education to students that were in training for a medical interpreter, as well as community healthcare workers. So that's that number 28 that you see there. And then we also provided training to 21 individuals that actually provided services in the community. And this is, of course, the seizure recognition and first aid certification training. And then also to the general public, where we reached 20. And this was, we set up at least 4 different virtual trainings that we offered to people. And again, the number was not really what we would have liked, but there you have it. And then with the health hubs that I mentioned to you in the last slide, you can see here the number. We reached 60 individuals and administered the surveys as well at these locations. And then this number is really surprising to me, but this is what I was told, that we reached out to, or we received and received response, and as well as reached out to a total of 100 service providers really across the state, advertising what we were doing with this grant, and then also offering to provide a seizure first aid and recognition training. And then you can see on the right-hand side, this is one of our social media posts that we did in both English and Spanish, and we reached about 5,734 individuals. And this was specifically posted, we chose in Eastern Connecticut to reach those in that area. All right, thank you.
Tanisha, are you with us?
Yes, I'm here.
Okay.
Hi, my name is Tanisha Tyler Graves. I am the CEO and president of When the Trumpet Sounds. When the Trumpet Sounds is a faith-based ministry where we believe that we need to collaborate with our church leaders as well as our communities as well as the families and caregivers of those who suffer at the hands of epilepsy. And so we have started a venture of targeting at least 500 Black African Americans who have been having issues with outreach material, awareness, being able to come to the table to collaborate on the many challenges that they may face when they go before the doctors, or even when they go inside of the churches, where the leaders of the churches and members of the church really don't understand what epilepsy is or how to treat the individual when they have a seizure or they're mentally delayed or have a speech impediment. And so I began this journey back of March of 2021 of last year. You will see at the top that is my son who died 9/2 of 2019 to SUDEP. And that is what drove me and stirred up a fire and a passion in me to serve people. Because we find out so many times that there are so many families who don't even have a voice, who don't even know how to actually address the confrontations that they may have with oneself when it comes to dealing with their child or the medical professionals. So we allow them to come onto a platform to share with us their stories and the ways in which we can help them. So we have been able to provide mental health resources, counseling sessions to them, doing resources, sending them out to places like Unite Us, providing them with different avenues to address the issues that they're facing day to day. Presently, Unite Us has become one of our partners. We have recently been able to help one young lady who actually has a mental challenge. I don't know how deep it actually goes, but we're still working on it. Unite Us is kind of hard to kind of deal with, but I did finally just recently learn how to manipulate that program. I also became seizure certified, and I also have become a seizure instructor, in which I actually held my first seizure certification workshop with Mrs. Cheryl Houston back in July. The bottom picture here you see is Mr. Lowell Evans, who is part of the EF, Dennis Terry, different ministries of motorcycle clubs that have actually came from Hampton, Virginia, North Carolina, Chesapeake to actually join in with us in the WTTS family, standing in front of the state capitol as we address Epilepsy Awareness Day. The next photo you will see is where we actually went in partnership with Ivy Baptist Church in Newport News by providing them with brochures and pamphlets and books that explain what SUDEP is. And so we will be going back. It may not be able to get it done before the end of this granting period, but I did actually give a couple of books to some people and challenge them to actually read it so that we can further collaborate with one another to be sure that they understand what they just read. Next slide, please. Just last month, I was chosen as the unsung hero by a Dose of Hope radio show, where I was nominated as a very assertive advocate working for the good of our population here in Virginia. So that was an honor. Strengthening and strategic alliance and partnership developments. We work along with Dr. Balkhalter, who is a neurologist. Many may already know of him. We also have been working along with Norfolk State University with Dr. Burwell, Dr. Tina Washington, who is a mental health specialist who only focuses on Black minorities. We also have had the privilege of having Dr. Dion Gibbs to actually come and speak to us on a health expert's vision of what health disparities look like and how to actually dismantle it in our upcoming conference. We have also been able to get into collaboration with Lawrence Golson, who is the lead of the NAACP of the Williamsburg-James City County chapter, and the Chamber of Commerce and the Williamsburg-James City County officials, welcoming us into the community as we open up our new office right here in the historical Williamsburg area, which we call Historical Triangle in the Colonial Williamsburg area. We have been able to get partnership with AHAC. I just talked to Mrs. Eileen Harris on last week, so I'm looking to actually collaborate with them a little bit more to be able to see where we can fit into and be of service to one another. Also, Pastor Mildred Ward will be one of our pastors as we pull the pastors out of the church back into our communities to actually help our families to be able to see the church leaders coming out and lending a hand, and to actually sit at the table to actually listen and to find a approach in which we can help the family members in our communities with disabilities. Epilepsy is where I have my pen on, but we know that disability and mental health is a big issue, and so is traumatic brain injury, which I just found out that I also have myself. We have also been in collaboration with VPHA, and we have become partnership with them as well. We have Reverend Morris Randall, who is our leading pastor, who's actually on our board, who's actually pulling together as a convener, a pastor's roundtable discussion to where we will have pastors coming together to actually speak amongst one another, where we will have someone from WTTS to actually take the notes down and report back to me so that we can strategize a plan to be more effective witnesses in preparation of serving our communities a lot broader. We also attended a Juneteenth event where we actually distributed 168 epilepsy brochures. This was actually at the Family First Baptist Church here in historical Williamsburg, where a lot of other different collaborative acts have been done with further nonprofits in the Williamsburg sector. Underneath this grant, we have also been able to start a program called So Well, where we actually do this at the Waldo C. Scott Community Center down in Newport News, Virginia, where we actually have been working along with the administrations of this said facility, and as well as the children, because we cannot forget that the children also need to be educated. Because when one sees someone actually having a seizure, they may not understand. So we have actually been taking the time to educate them and to send brochures home with them to actually sit down to discuss it with their parents as well. And if any questions are needed to be answered later, they can bring it back to us and we'll be willing and able to address those issues with them. We have also been able to partner with the motorcycle club called the Ambassadors of Jesus Christ Motorcycle Club. They are out of Chesapeake, Virginia. And with this motorcycle awareness ride is where we first started. They actually came in full speed ahead, grabbing hold of other motorcycle clubs to actually join in with us to make sure that the education is being put out there is really the awareness. A lot of people doing this said motorcycle event, they were eager to know how does epilepsy affect the family? What should they do? I've heard people tell me during this actual meeting that we had in front of the Capitol that, oh, we need to put blocks in their mouth. I said, no, you surely don't do that. So then I had to start educating them the do's and don'ts of epilepsy and what you should not do. Mount Uno Bible Evangelistical Teaching is a school that I'm actually a part of. So I'm constantly talking to my peers in regards to making sure that the education is being put out there. Some have even came on to get seizure certified with us during the day of us having our first seizure workshop. So that was a very awesome and great feeling to know that people on the outside that who you think wouldn't come in and support would actually come in. I also attend another school, which is called Williamsburg Theological Seminary, where I am in deep collaboration with 15 other people, which would be the students and the pastors, where we talk about ways of being of help and service of one another in order to be able to pass and address the issues when it comes to epilepsy. I have also had the opportunity to actually sit down with some of the delegates, being our pro temp Senator Louise Lucas at an NAACP affair where she was being awarded for the services that she has done here in Virginia, as well as working along with Delegate Jay Jones, Delegate Bagby, and a few others. So I'm looking forward to continuing on with the work that Epilepsy Foundation and CDC has. It's much work to be done. We have an upcoming conference scheduled for August the 27th, where we will be working with some big organizations, Divine Nine, HBCUs, some doctors, some mental health physicians, just to bring things to the table so that the community can come in and learn from us and we can learn from the community. Thank you so much, EF and CDC. You all are doing a wonderful job.
Thank you so much, Tanisha. We really appreciate all your efforts. And I'm so glad that you actually became a seizure first aid instructor. So, all right, so we're gonna move on to Los Angeles. Rebecca?
Good afternoon, everyone. All right, so diving into it. So the overall goal for the grant and how we wanted to execute it here in the greater Los Angeles area was to improve the quality of life of people with epilepsy in diverse and non-English speaking communities. So as you can see there, we had a goal of educating 100 public health professionals, social service, identify 5 new resources for unmet needs, specifically for food and housing. And we want to connect at least 50 non-English speaking people with epilepsy to the community, which includes getting them involved in our activities and programs and information and resources. Next slide, please. So I do feel like we still have a lot of activities underway that we will be continuing post the close of the grant period. You know, I feel like a lot of what we were able to achieve during this grant period was, again, identifying new resources and then really identify new partners. So a lot of those partners, you've heard about AHAC, people have been mentioning a lot, the area health education centers. We've connected with our folks in California and exploring partnerships with them. And then there's been a couple other partners that have come up through the grant calls that we've held monthly. And so those are partnerships that are being developed. And again, finding those resources have been really helpful. We actually manage our own information and referral helpline here in LA. And so we actually ask a lot of questions, field a lot of questions, collect a lot of data. But food and housing have not previously been one. So as we've accumulated those resources, we are starting to tally and make sure we're asking our folks that reach out to us. One of the things we've done digitally is we have actually purchased a WordPress plugin called G-Translate, and that has allowed us to edit in real time the translation that's on our website. We're able to more easily create domains for those specific languages, so we can actually share those to folks of that language. Let's see, we're in development of a dedicated web page of resources. Again, we run our own information referral, so we have a lot of great local resources, but we're just accumulating those on a web page. We were able to also take great advantage of the social messages that were pushed out from National African American Month and quite a bit of others. So that's been great. Where we really felt like we were going to be able to connect with our non-English speaking community was just having increased visibility at our epilepsy centers. Specifically, there's a local epilepsy center here, and they have at least a 30% patient population of Spanish speakers. And so we are working on a resource area, quite literally physically in their waiting room. And this will include tangible brochures and items. But primarily what we're really excited about is the development of a digital display and a digital interaction tool. And this will physically be an iPad that is locked, so people can't, explore the internet. But we will make available specific resources on that iPad. We will have a link to that webpage of resources. We will have information about our events and programs. We'll have information about epilepsy. So we are going to, it's kind of a beta at this local epilepsy center. And then the information that will be digitally displayed, as well as that tangible information at that clinic, will also be duplicated in materials, tangible materials at other epilepsy centers. So our trainings, I feel like we've actually done really, really well. Again, some of the new partnerships that we have identified through this grant project, those are still in development. But we actually more recently educated 153 health professionals and coordinators at our Lanterman Regional Center. We have strengthened our relationship with the promotores, and you can see there on the slide that we've trained 28 healthcare professionals, and we are actually in talks as of yesterday about an upcoming program with them as well. Let's see, we also, I think it's about 150 the integrated collaborative, it's ICC. I always forget that last C, but these are specifically Spanish speaking health advocates, and they're parents, they're volunteers, and they go through extensive training to assist people with disabilities. And so we were able to provide a seizure first aid and seizure recognition training for them. So that was quite an accomplishment. One thing, it's related, but our first responders are police. We actually were up in Bakersfield and trained 150 of the cops that are on the street. So we were really proud of that accomplishment. And that wraps it up for me. Thank you, Tometta.
Thank you, Rebecca. Okay, so now we are going to hear from our last external grantee, the National African American Male Wellness Agency, which was in collaboration with our regional team in Ohio and Indiana. And Dr. Higgins was not able to be with us today, but she did provide a couple of slides. So I will provide that information actually after we hear from Marlon. Marlon, are you with us? Okay. Oh, are you on mute? Hold on for just one moment. He's unable to speak. Okay, try now, Marlon.
Ooh, okay, there we go. Hello.
Right, there you go.
All right, sorry, I got a little worried. Biggest fear on a virtual meeting is doing something wrong. Again, my name is Marlon Platt. I have the honor of serving as the Director of Strategic Partnerships with the African American Male Wellness Agency. Excited to work with Dr. Higgins and Ms. Tometta on this great project. And so really our goal is committed to raising awareness in predominantly Black communities surrounding epilepsy. A lot of times we as African Americans are really only focused on general things such as blood pressure and diabetes, things that we hear more commonly in the African American community, and epilepsy doesn't typically arise in those conversations. So our big focus was awareness, both around epilepsy and seizures, and also the Epilepsy Foundation organization as a whole, to be able to direct people to get resources and really make it more of a common conversation piece. Throughout the duration of our project, we were able to distribute over 140,000 flyers with EFA branding, which is great. A lot of door-to-door access, going into the actual communities, reaching people at grocery stores, at barbershops, at beauty salons, at shopping centers, at churches, just places that African Americans commonly live and dwell. We were also able to put up 18 billboards reflecting EFA, which draw a lot of questions around who the organization is and what how our partnership came about. And then 150 posters, which were also distributed within the community. The centerpiece of our awareness campaign is our signature event that we host here at the African American Male Wellness Agency, the African American Male Wellness Walk, which was actually this past Saturday here in Columbus, Ohio. We had over 30,000 attendees in attendance. We're waiting on the final numbers to get back. We think it's 40, but for now we're just playing it safe. And EFA was able to be a vendor along with the African American Male Wellness Agency at 2 separate tables. And we use that as a great opportunity to really distribute more information. We also had a great VIP reception, which we work with a lot of local community partners here around Central Ohio, including the Franklin County Public Health Department, the Columbus Metropolitan Housing Authority, the Columbus Public Health Department, as well as a number of other providers in the area who either are clinical or community-based organizations or health and wellness organizations. And so a lot of opportunity to cross collaborate and network. There was also a large ad in our VIP reception booklet, which really just advocates and shares and spreads more awareness about epilepsy and particularly its effect in the African American community. Our engagement in our community partners, we actually host a annual mental health summit, which is geared towards African American men. This year, the summit was held on July 14th, shortly after our last meeting. We had a special guest and keynote speaker, Mr. Music Soul Child. And he just talked about the experiences of one, being a care provider for those who have health needs, and also just dealing with this whole mental health issues and how to go about getting resources, which is a good lead into the work that we're doing with this project. The Columbus Metropolitan Housing Authority Night Out, which is a great opportunity for us to engage one of their 30,000 resident locations here, 30,000 resident housing authorities here in Central Ohio. And they also have the King Arts Complex Heritage Music Festival, which is really a 6-week music festival in the heart of the community. A really good opportunity to share and distribute information. And then we've also hosted our own male worship service during our Black Men's Health Week, which is an opportunity for us really to engage those of the faith-based communities. And so exciting opportunity. Again, we're really just pushing awareness and getting more people to know in addition to the surveys and referrals. Next slide, please. So as a visual person, I really wanted to add this slide in. This is from our event that I spoke about on the previous slide, the African American Male Wellness Walk this past Saturday. As you can see, there are a couple familiar faces on the top with Mr. Mehta and Dr. Hagens, who were actually able to come out and attend the event as vendors and distribute information. I'm currently wearing my End Epilepsy purple wristband that I obtained at the event, and just really want to give a visual as far as what we're doing. A lot of different community organizations, over 160 vendors, and these are not sales vendors. These are more so community groups who are sharing resources and information or who have connections to people. So we're talking other corporations, fraternities, sororities, church groups, and other social service agencies who can provide support at this event. We also coordinated free health screenings to be provided. As you can see, the gentleman in the bottom middle is in the middle of getting his health screening prior to our 5K walk and run, which is really to raise awareness about health issues in the African American community, including epilepsy. And so that is a good shot of us turning on the first stretch of the first leg of the 5K and getting a good look at the people. Again, a great opportunity just really to share information. And we were also doing signups for our African American Male Wellness app. We had about 1,000 people log on and register to the app. And so we're going to use the app as a platform to be able to share surveys and more information about seizure first aid trainings and also epilepsy awareness information. And we have a follow-up email blast going out once we get all of our data compiled here this week to share other opportunities about how people can get seizure first aid certified and trained, and about where they can find more resources with EFA, and also to be able to take the survey as well and get referral to community resources. And Ms. Tameta, that is all I have.
Thank you so much. And as again, he said, we were able to be there, Crystal and I, so that was a great time. Also, I wanted to make sure I highlighted their organization because they actually do this walk in several cities throughout the country. And so you will hear more about those opportunities. We would like for the Epilepsy Foundation and our network to be a part of these particular opportunities in the African American community, again, targeting African American men, which we know there's epilepsy disparities there. And so you'll hear more about that. Again, this organization was in partnership with EFA's regional teams, specifically Ohio and Indiana. And so one of the things that Dr. Higgins did is that she had a public health intern work with her to look at food insecurity in Ohio specifically, so that they could try to add more of those resources. And so they were able to talk to and connect with 40 different food banks that are in the state of Ohio, so that we can try to find out if they were willing to serve as an opportunity for referrals, and be able to then refer back also to us if they were able to identify individuals who were living with epilepsy. And so with that, they did determine that there were some challenges and barriers to being able to do that. And I think, again, a lot of our grantees have seen, realized this across the board in terms of working with community, different organizations. You have to be able to make sure their contact information is up to date. Many of us have that issue. That's why we really don't do a lot of resource directories anymore, unless they are in an opportunity where you can keep that information up to date regularly. And so also some of the food banks, again, are understaffed. And so there was only able to talk to them one time a week or so. And if you didn't catch that person during that time frame, then it was hard to be able to get in contact with them. Also, there were some that were very interested in being able to receive more information around epilepsy and how to connect with EFA specifically in Ohio. And so also some of them did provide information to be able to actually be a part of our information and referral hotline at the national level as well. So again, I wanted to highlight this because this was a great opportunity, an example of how our regional teams can work with our community organizations and still be able to focus on determinants of health and pursue some of these mini grants. Okay, and with that, we'll go to our last grantee, Jenna.
Good afternoon, everyone. So I want to echo my thanks on behalf of EFMN to EFA and CDC, and to you, Tameta, for your leadership in this effort and for all of the resources and information that you've provided us along the way. Really, really appreciate it. So I will just jump right in. Our first objective under this grant was to increase knowledge of epilepsy and EFMN resources. And we focused primarily on Minnesota's Latino community, including new immigrants and refugees, as well as established descendants of Mexico and Latin American countries. And we did this because Minnesota's Latino community is the fastest growing minority population, with a projected 57% growth between 2021 and 2035. We also know that in Minnesota, 70% of Hispanic Minnesotans have reported some form of food insecurity. And we also know that Latino Minnesotans are more likely to live in unaffordable housing and experience homelessness compared with white Minnesotans. So since 2020, EFMN has increased our capacity to serve the Latino Minnesotans by hiring 2 Spanish-speaking regional outreach managers. And then thanks to this grant, we were able to improve the resources that we have to reach the Spanish-speaking community. And I'll talk a little bit more about that. So our first strategy was really focused on partnering with a social service agency serving the Latino community to do seizure first aid training. And so we identified Neighborhood House as the organization that we wanted to work in partnership with, or as one of them. And they are a community center that primarily serves immigrants, refugees, and low-income individuals in St. Paul's West Side neighborhood, which has one of the highest concentrations of Latino individuals in our state. And Neighborhood House themselves offer 2 food markets. They distribute food weekly, and then they also provide case management services to individuals. And so we were able to train 34 of their staff members on seizure first aid, as well as the services that EFMN can provide their clients. And I will talk a little bit about, we do participant impact surveys after our trainings, and I'll talk a little bit about those results in just a minute. Our second strategy was to partner with a statewide serving organization. And so we identified Cluez as the organization we wanted to partner with, and they have been a great partner. So they are a social service organization that provides health and wellness programming, food security programs, and then housing resources for Latino individuals across the state. And they have offices in St. Paul, Minneapolis, as well as 2 rural offices in Austin and Wilmer, Minnesota. And so we were able to visit their food distribution events and set up seizure and epilepsy resource tables. We were able to, at those events, interact with 40 individuals that either had epilepsy or had friends or family who had epilepsy or seizures. We were also able to share our newly developed Spanish language resources with their staff, and it was especially valuable for their rural staff, was feedback we got. And then we also will be tabling at one of their largest events that's coming up here in September, Fiesta Latina, where we will have a tent and a table and be able to provide resources to individuals there and share the different programs and services that we can provide. So then our third strategy under this objective was to join the Minnesota Public Health Association. So 4 members of our Mission Outcomes Leadership team did that and attended their annual conference. I will also be attending the APHA conference this fall. And then our fourth strategy under this objective was to identify opportunities to partner with CHW related organizations in Minnesota. And so we have been in conversation with the CHW Alliance to understand how we could work with them and potentially train current CHWs across the state in the Managing Epilepsy Well toolkit. We also are in the beginning stages of identifying strategies to, we're in the beginning stages of exploring our own capacity as the FMN to support the hiring and employment of CHWs so that we can be out in community and building those relationships, those trusted relationships. So I mentioned our participant impact surveys that we ask people to fill out after all trainings that we do. And so we do have some results from those and related to this project. So 98% of participants indicated that their knowledge of epilepsy and seizures increased. 90% indicated they are able to recognize various seizure types. 94% indicated they learned how to respond to seizures. And then 93% gained a better understanding of how epilepsy can impact a person's life. So overall, very good results. Our second objective was to increase access to epilepsy resources. And so, as I mentioned before, we developed new Spanish language training videos. And then those trainings are available for download for free on demand on our EFMN website. And then we also shared those trainings broadly with the Latino serving organizations that we know in our network. And so from April 7th to July 26th, we had 55 downloads of the 30-minute Spanish language Seizure Smart training video, 23 downloads of the 60-minute Spanish language Seizure Smart training video, and then 11 downloads of our Spanish language Seizure Smart school training video. And these are all available on our website, as mentioned before. And then our second strategy related to this objective was to translate some of our key documents, especially as it relates to EFMN social determinants of health support programs, into Spanish, Somali, and Hmong. And so Somali and Hmong are the second and third largest populations of color and immigrant refugee populations in Minnesota. So wanting to make sure we have educational resources and information for those communities. And then we are also going to be, we've launched some new healthcare provider partnerships, and the Minnesota Epilepsy Group and Gillette Children's Hospitals have indicated that they want to share these resources with their patients in Q3 and Q4. So that hasn't happened yet, but will happen. So we're very, very excited those resources will be shared even more broadly. Our last and third objective is that people with epilepsy are connected with support resources. So EFMN created and piloted the use of a care assessment that identifies people with epilepsy's current access to and participation in SDOH resources, as well as logistical and geographic barriers that prevent them from meeting their social, mental, and physical needs. And then upon completion of that care assessment, we create a care action plan for each case, which includes referrals to external partners and EFMN's own internal programs and services. And so right now we have been administering these care assessments to people who were referred directly by their healthcare providers through our new partnerships. So we, in all honesty, we have not done very many up to this point, but we are bringing more healthcare providers on board. We're troubleshooting with our current healthcare providers. And then we also do run our own information services line. And so are going to be expanding this care assessment process to people who call us outside of a provider referral. I will also mention with our care assessments and action plans that they were created in alignment with the CDC's Managing Epilepsy Well research, as well as an analysis of the needs most commonly identified by our information services team. And then we also incorporated that into our client database to ensure that, we have seamless access to the information and that we have accurate evaluation of the impact, and that we're working in alignment with our other programs. And so with that, our next steps are, again, to expand our healthcare referral partnerships. And then we are also going to continue exploring the CHW model of support, training CHWs across the state. And of course, we will continue to maintain and enhance our relationships with the Latino serving organizations that we have been very busy building trust with and supporting their clients. So with that, I think that's it. Thank you.
Thank you so much, Jenna. All right, we do have some time to take questions, but before we get to that, I wanted to give our CDC project officers an opportunity to make some remarks. I know one of them has to jump off, and so I wanted to give them that opportunity before we took any questions that we may have.
Thanks, Tamara.
Oh, no, go ahead, Maggie.
Oh no, Rosemary, I don't have to get off, so you talk first.
Okay, yeah. Hi, everyone. I'm Rosemary Kobow, the CDC Epilepsy Program Team Lead, and I'd just like to say thank you. Well done. I think it is absolutely wonderful to hear about all of these new partnerships that so many of you have developed with other local organizations in your communities, some of which were new to you. And it's wonderful to hear that you've had good experiences with leveraging these new relationships. Loved hearing about the Delaware Library listserv, for example, but too many good examples to highlight, but well done, keep it up. This is so important, and it's very validating to hear the unfortunate ongoing needs of our community. So let me leave it there because I do need to hop off, and I'll turn it over to Maggie.
Thanks, Rosemary. Yeah, I'll echo what Rosemary said. We're just so thrilled to see the truly awesome progress that all of the mini grant recipients made in a really short period of time this year. These were not very long grants. We know that food and housing insecurity is a major concern for so many people with epilepsy. And as we all know, if you don't have those basic needs addressed, it's nearly impossible, right, to successfully control your epilepsy. You just couldn't possibly do that if you don't even have the basics covered. But we don't know if that's a problem unless we ask the questions. So we have to really understand first what everybody's needs are before we can even begin to understand how to meet them. And I'm so gratified to see how many of your organizations are starting to ask those questions and partnering with other groups who can ask those questions and meet those needs. CDC and really public health in general has been very focused on social determinants of health, for the last, for forever, but with an enhanced focus for very good reason. And as Rosemary just said, we have extreme needs in our community, and that's no different in epilepsy. The disparities can be very significant. And so through our funding at CDC, we've directed all of our grantees to focus on health equity, social determinants of health. The National Epilepsy Foundation is doing this in lots of different ways through all of the projects that they're doing. But these grants, I think, are really obviously like the major piece of this. And like Rosemary, I love hearing about the new partnerships that you're making with public health, with faith-based groups, community organizations, AHECs, your state public health partners. I really hope that these will be connections that you have for many years to come. I want to say congratulations to all of the grantees for all of your wonderful accomplishments. We're so proud of you. And thanks and congratulations to Tamara, who's done a really awesome job providing technical assistance to everybody, helping make connections to new partners, and providing resources for everyone. So thanks and congratulations.
Thank you so much, Maggie. With that, I am going to open it back up again if anyone has any questions. I do see a statement that's in the Q&A that I want to make sure that I read because I do think it's exactly the same way I feel. And so EF Michigan wants to share that they are really impressed with the connections and the impacts that have emerged from these grants. Very well done. I feel the same way. This is our first time for being able to have a intentional focus on determinants of health. And as many people have expressed, you know, it is new for them in terms of really asking intentionally about these particular areas of life. And so as we continue on this journey for the next 4 years, I hope that many of you, listened and heard about what your colleagues have done and are considering, to be able to do the same with or without, actually getting a mini grant, because this is the work that we need to, start doing and turning our attentions to. And collaboration is the only way we actually are going to be able to see the mark be moved in terms of epilepsy disparities. We're not going to be able to get it all done as being the Epilepsy Foundation. We have to work in collaboration and in partnership. All right, so I see some other questions or comments. So I'm going to make sure I try to go. And people are saying thank you. Oh, thank you to you guys too. This has been great. Are there any other questions? If not, then I am actually going to see if our Chief Outcomes Officer, Dr. Brandy Furman, would like to make a comment or two before we let everyone go. Oh, Brandy had to jump off. I'm sorry about that. So she has already jumped off, but I know that her sentiments were the same in terms of the aspect of being so impressed with your projects. So next steps in terms of what is happening with these projects is that they still do have until early September to wrap up their projects. We will be having a debriefing meeting. That's going to happen in the middle of September. And then, as I said before, and as has been mentioned on previous calls, our first year for this cooperative agreement ends at the end of September. And so in October, we'll be starting to turn our attentions to year 2. If you have any questions for me between now and then regarding year 2, the mini grants that we'll be giving out again, they are $10,000 once again. We do understand that this is a sprint. It's we're asking for you to go ahead and start thinking about those partnerships, those collaborations, what you realistically think that you can accomplish. And that's another thing I want to make sure I mention, is that we do not expect you to do unrealistic lifts. So being able to look at your processes in terms of how you're working in rural areas in your state. How are you engaged? Community health workers, lay health workers, promoters in your state or in your region? Have you looked at the aspect of digital inclusion for the individuals who are living with epilepsy in your state or region? Those are the things that we want you to consider. And if you are saying no, then how would you be able to do that? And who are partners that you can work with to help you to be able to address that? That's what we want you to consider. We do want this to be a systems change. As many of you have heard, many people have embedded questions around social determinants into their processes, into their intake, into their outreach. That is what we want to happen. But we're not asking you to, come up with brand new systems or buy brand new systems. We understand that it's not a lot of money and it's not a lot of time. So, but I am here to help and support you and think through that. So as we turn our attentions to year 2, and if you have questions about who you could be working with, who you should be working with, and projects, if they're feasible or not, feel free to reach out to me. And here is my contact information for anyone who does not have it. And then I will now see if there's any more questions before I let everyone go. Okay, I'm not seeing any other questions. A lot of kudos though, and I'm going to say thank you again. It has been an honor to work with all of you There will be a lot of follow-up as, again, for headquarters, we take this as an opportunity to learn about what is happening in the field and how we can help others to be able to replicate. And so as we talk about dissemination and sustainability, again, we will be reaching out to all of you. And all right. Okay, so with that, I am going to let everybody go. Have a great day, and congratulations to everyone. Oh, one last question about getting the slides. Yes, we can get you the slides, no problem.